Namaste everyone. Welcome back to live stream sessions. This is Dr. Meenakshi. So today I am discussing about the leucorrhea, that is the vaginal discharges. Are many women will be having the questions about these discharges, right? Some will say I am getting frequently discharge from the vagina area, maybe watery discharge or thick discharge, and some will be having questions that middle of the cycle, menstrual cycle, I'll get some days, I'll get even they will not notice that middle of the cycle also. They will observe that some days I'm getting discharge and later it will be stopped. And some will take it serious that I'm getting discharge, whether I had any health issues related to intermittent area. Many questions they are women will be having related to this discharges, right? So I thought to discuss about these vaginal discharges, which type will be and when it's normal and when we should consult a doctor, and what all preventive measures we can take to prevent this vaginal discharges we'll discuss today. So as I mentioned, this vaginal discharges are, in medical term it is known as leucorrhea, refers to the natural secretion that are released from the woman's vagina. It is a natural secretion from woman's vagina. These secretions are responsible for lubrication and prevention of infections. Obviously, of course, in initial stages, without any complications or without any complaints, if it's a normal discharge secretion, just if it is a secretion, then this secretion is natural and it's common, and it makes the lubrication and it prevents the infection from the vaginal area. Whichever the infective foreign body tries to enters the vaginal area, this lubrication will prevent it, will make it sticky and will make it loose to move outwards. It will prevent the infection in initial stages. And reasons, what are the reasons for this lubrication or secretion, and what is the reason for this lubrication which we get secretion from the vaginal area? To see the reasons, the common causes of leucorrhea are maybe pregnancy. If you are pregnant, the secretion or vaginal discharge may be common, or in premenstrual days, or in menstrual cycle periods, it may be common, or in infections of genital organs, it may be common. But the complaints will be different in infective stage and normal stage. We'll see in further. But these are the reasons, maybe the causes. One of the infection to the genital organs, and or hormonal like irregulation, hormonal imbalance. These all are the causes to get the secretions in the woman. And this leucorrhea or secretion from the vaginal area is normal. But when it is normal, it is clear and whitish and has no any odor. If secretion is there in small amount, it's a normal. But when it is a normal, it should be white, it should be clear, and it should be without any odor, without any smell. And it is normal for your body to produce a small amount each day. If you are some women, not all, some women will complain that you will be having small amount of discharge every day. Actually, it's a common and it's a normal. You should have this secretion in small amount, like maybe example for up to 1 tablespoon of secretion every day for a woman is normal. Actually, it's considered as a fertile period, like fertile sign. If you are having this secretion, it's a sign of fertile reproductive organ of your body. During the middle of your menstrual cycle, you may notice that there is a discharge, becomes thinner and sticky like whitish of an egg. If you are having regularly like small amount of discharge, it's a common. If you won't have also, during middle of your menstrual cycle, maybe during your ovulation, especially during your ovulation, how this discharge will convert from whitish or thinner to, it will become thinner like jelly like structure, and it will be stretchy. For example, like egg of white. white part of the egg, how it will be? It will be like that. It will be present during during ovulation, in middle of your menstrual cycle. Actually, this is the sign of your ovulation. If you had this thinner, stretchy discharge from the vaginal area during the middle of your menstrual cycle, it is the sign of ovulation. And leukorrhea is a type of early pregnancy discharge too. Again, rather than this normal, regularly little amount or in middle of the cycle, when it is normal to have a secretion during your pregnancy, especially early pregnancy, sign is one of the discharge. Especially like how we gave example, like egg white during the ovulation. During early pregnancy, your discharge will be like somewhat milky color, like some will have milky color, or some will have pale color discharge during early pregnancy. When you miss your period, like if you missed your period like 30 or 34 day, and you have a little amount of pale color discharge, then it's a sign of early pregnancy. And not only in early pregnancy, in whole pregnancy you will be having some or other amount of little amount of discharges. That is normal. Again, this discharge is a as I said, fertile sign, and this discharge during pregnancy is sign that your baby is healthy, your baby is growing healthy, and the development of a fetus is healthy. Again, in complications, other complaints you will be having, and amount of discharge will be more, that will be prone to infections. But small amount without any odor, and the less amount of discharge per day on every day basis is normal. And as we saw the reasons for this secretion, normal secretion, the causes for infective leukorrhea, that large amount of initial secretion what we get, these are what we discussed, maybe during daily a little amount, or during middle of the menstrual cycle, or during the pregnancy. These all secretions are normal physiological process of the body. But when it comes to the complaint like heavy discharge, that will be formed as a term, medical term as leukorrhea. What are the causes for this normal secretion turned to infection or leukorrhea? Are sexual intercourse, that is unprotected one, especially maybe it may cause infections, it may cause leukorrhea. And nutritional deficiency, in some women who will be having nutrition deficiency due to maybe body stress, or due to their workload, they may be having discharge through vagina. Or poor maintenance of hygiene in intimate areas. If you didn't maintain hygiene in the intimated areas, then it may cause infection and have the large amount of discharges named as leukorrhea. And other female reproductive infections may cause the leukorrhea, that is large amount of discharge from the vagina. And in infections of urinary tract infections, UTI, what we say, urinary tract infection may cause the large amount of discharge, that is leukorrhea. And fungal or bacterial infections, and vaginal irritation due to insertion of contraceptive devices, due to irritation in the vaginal area, it may cause the secretion, large amount of secretion, and it may cause the infection. And in anemia conditions, these all are the causes why this normal secretion will turn into leukorrhea, or will turn into the complicated discharges which have the complications. And what are the symptoms of this leukorrhea? When we can say that normal secretion is not there, we have some complications, so that we should consult a doctor. What are the symptoms? Your discharge will be foul smelling vaginal discharge. It will not, whereas what we discussed till now, that is normal secretion per day, or the vaginal discharge during the pregnancy, or in the middle of the menstrual cycle, these all secretions will not be having any foul smell. Just there will be small amount of discharge will be present. But whereas in when it turns to leukorrhea, that is in complications, when it turns to the medical condition, Then this discharge will be present with foul smelling, pain in the stomach, or cramps will be present, and there will be constipation, and there will be repeated or frequent headaches, occurring of headaches, and itching sensation, especially in the vaginal area, and pain in the lumbar region. These all are the symptoms or signs or symptoms present when the secretion turns towards the medical condition. Whereas normal secretion is, as I said, it's a normal condition, and it's obviously, of course, it's a healthy condition. But if these all complaints are there with secretion, then it turns towards the medical condition. That is, the discharge will be foul smelling, the discharge will be larger amount, that is more than 1 tablespoon, and pain in stomach and cramps will be present, pain in lumbar region, itching sensation in the vaginal area, and headache, frequent headaches will come, and constipation due to this secretion, or due to constipation, the vice versa, the secretion will be more and it may cause infection. So these all are the signs and symptoms. Coming for types of leucorrhea, that is, one is physiological and another one is pathological. Whereas physiological is normal secretion without any complaints, what we will have in a pregnancy, early pregnancy, or during menstruation or pre-menstruation, or during ovulation. These all discharges comes under physiological. They don't need any type of treatment, obviously. Like, for example, if you are getting secretion in the time of ovulation, after your ovulation period, automatically it will stop. Or if you are getting premenstrual period or premenstrual days, if you are getting secretion, after getting menstruation, after completion of menstruation, it will stop. Or in pregnancy, if you are getting, then after your pregnancy, obviously your secretion will stop. These all comes under physiological. Whereas pathological is due to any complaints, or due to some complications, we are getting the secretion through vagina. That is, as we saw, the causes. Due to some causes, if we are getting discharge from the vagina, then it will come under pathological. That is, maybe cervicitis, or maybe the infections, or maybe the trichosoma vaginitis. These all are the some reasons. Due to these, there may be complaint of discharge from the vagina. And how that discharge will be? It will be accumulated with foul smell, thicker, and itching sensation will be present. All signs and symptoms what we saw, those all will be present with the complaint and with the secretion. So these all will come under pathological. And the secretion also will be in different colors. Like as we saw in ovulation, it will be thinner and sticky. During early pregnancy, it will be thicker, milky white or pale color. And in infective stage, it will be yellowish color, or with the itching, foul smell it will be. And in pregnancy, it will be like pale color, thicker, or milky white, thicker discharge will be present. Depends on your condition, depends on the condition of a secretion, the color of discharge also will change, and the consistency of the discharge also will be changed. Whereas, as I said, on normal basis also, or normal each day, if any small amount of secretion is there, it's a normal, it will be usually watery discharge. No any thicker or jelly like structure it will be present, only water discharge will be. And in nutrition deficiency, usually they will be having watery discharges, like only water discharge they will be present in nutritional deficiency, or in severe stress conditions. And premenstrual period, like if we are expecting our period to come within 2-3 days, we will get some pale color discharge, thick pale color discharge. That is also normal. And after initiation of menstrual cycle, it will disappear. That is also normal. So this discharge will vary according to the conditions, according to the days and according to the pathological condition of a woman. And so now we got to know what is this discharge, when it is normal, and what is the condition of complaints, that we have a medical condition of this discharge, and in normal also in which all conditions when we will get the discharge. You all got to know now, right? These many days what you were thinking that if you are getting any vaginal discharge, you are taking tension, right? If you have any medical fields friend, you were calling them and you were asking, or when you go for gynecologist, you were asking them that I'll be getting discharge, what is this secretion I'll be getting, whether it's normal or not. And especially our pregnant women, in pregnancy they were asking repeatedly for their gynecologist, for in every visit, I'll be having this much of discharge, whether it's normal. And in pregnancy also, when we get any discharge, obviously we will go in tension, right? I had a discharge, whether it's normal or not, I don't know, right? So now you got to know what is the normal type of discharge or secretion. So on that basis, you can correlate that you are getting discharge or secretion is normal or abnormal, right? So coming for treatment, if you have any secretions, maybe it's normal or abnormal or more quantity, how we can treat this? That is, first we should treat the cause. If it is a physiological discharge, as I said, after that days, obviously your discharge or secretion will stop. But if you have a pathological discharge, obviously you should go or you should treat the cause there. What is the, if you have infection, you should go for anti-infective drugs and you should treat that. And if you have any like pathological conditions, then you should treat that cause, and so that automatically if you treat the cause, your secretion will stop. And coming for preventive and in treatment, according to our Ayurveda, usually they will go with the Crimigna drugs. If you complain with the discharge with false smell or anything, they will go for Crimigna drugs. And if your discharge is in large amount, they will go for Yoni Prakshalana. Obviously, modern also, with the oral medicines, they will give some medicines to has vaginal wash, right? Like for normal common brand, we have B wash. Like that, they will, according to their practice product, they will go for vaginal wash. Like same way, in our Ayurveda, we will go with the Crimigna drugs. With that, if we feel that the woman is nutrition deficiency, or woman is anemic, or woman is weak, then we will go for Medhya drugs with the Crimigna, and we will have the Yoni Prakshalana. That is nothing but equal to the procedure of vaginal wash. But this vaginal wash, they will advise you only to do it. In our Ayurveda, we have a particular procedure to follow it in Panchakarma setup. So we will go for Yoni Prakshalana procedure in vaginal secretion conditions. If it is normal, obviously they will not go for any treatment. If it is a pathological condition, then they will go for treatment. And coming for preventive tips, how we can prevent that we came to know some secretion is normal, but how we can prevent it to going into complications or to going into the complaints. So first one, maintain healthy diet, because we got to know in nutrition deficiency also we will get the Leucorrhoea conditions. So maintain your healthy diet, maintain good personal hygiene, especially taking care while contraceptives, because we saw in causes that even contraceptives insertion may cause the Leucorrhoea, right? So maintain good personal hygiene in especially in the time of use of contraceptives. And suppose you notice any changes in vaginal discharge, the consult the physician as soon as possible, because though we got to know some amount is normal and some days its secretion is normal, but by thinking this, it's a normal condition, if you neglect, it may go to complication, and you may have the health hazards, like maybe This vaginal discharge may cause complications in reproductive organs, or it may cause the severe infections in the intimate areas. So by thinking this, the discharge is normal. If you have a small amount of discharge without any smell or without any complaint, without any itching, you can wait for a days, like 2-3 days. Obviously, if it is a physiological, in 2 or 3 days it will subside, right? If it didn't subside and your secretion is increasing day by day, and if your discharge is with smell, and if your discharge is thicker, not a watery or not a jelly type, then as soon as possible take a visit to your gynecologist. As I said, when these physiological secretions are normal, but when to seek a doctor, women's, especially pregnant discharge, uh, when it is normal, like small amount in pregnancy, if you are getting secretion in pregnancy, you can, if it is discharge is small amount and milky white, you can wait. But if your discharge is more, and if your discharge is combined or stained with blood and any other colors, then immediately consult your gynecologist for safer side, because in pregnancy we can't neglect any condition, right? So for safer side, consult, visit your gynecologist. They will advise you according to your complaint. And coming for um, in normal women without pregnancy, this is about the pregnancy, right? If you have small amount discharge, you can wait, or if it is increasing, if it with the complaints like itching and more quantity, larger quantity, then you can consult your gynecologist. If you had a discharge without pregnancy, in normal women without pregnancy, also some women will be having discharge, like as I mentioned, before menstruation, or in the middle of this menstruation cycle, or during the ovulation. These all discharges are normal. But these all discharges, and rather than these days, if you won't have any middle days of the menstrual cycle, and if you won't have any like menstrual cycle nearer to menstrual cycle period, if you won't have any physiological condition, then too you are getting a secretion, one thing, discharge. And if your discharge is with smell, with itching, or with cramps, abdomen cramps, if discharge is present with these three complaints, then as soon as possible consult your gynecologist. They will advise you antifungal medicines, and first of all they will take your history, complaining history. According to your complaining history, they will diagnose a condition, whether it is infective stage or whether it is any other conditions. Then they will go for the treatment according to your complaints. So this was about the leucorrhea, that is normal vaginal secretion. Now I think all women got to know when this secretion is normal, and when we should consult a doctor, and what treatment or preventive steps we can take to prevent this leucorrhea. That is, if it is normal secretion, if you maintain a healthy diet, personal hygiene, especially during contraceptives, or especially the hygiene in the intimate areas, if you maintain hygiene, obviously your secretion will be healthy. This is a natural process or physiological process, which our body only creating secretion and preventing our body from the infection. But the maintaining this secretion in a healthy way is in your hands. If you prevent the secretion to move towards the complication, then your reproductive system will be healthy and fertile. If you neglect and if you didn't follow the preventive tips or the routine activities, obviously it will move towards the complications, and it will create the complaints. Especially, I forgot to mention in the tips, preventive tips, as I mentioned, personal hygiene. Obviously, washing your vagina daily basis with lukewarm water. No need to apply any soaps in this area. With lukewarm water you can wash. And another thing is, use the underwears, panties which are comfortable. Obviously prefer cotton cloth, whichever comfortable for your skin, because skin will be very sensitive in this area. Choosing your panty cloths is very important, because this may cause itching and this may cause the secretion into complications, infections. And another thing is using your sanitary pads, because using same sanitary pad for longer duration also may cause the infections in intimate areas. And the last point is about the sexual. During the sexual intercourse, maintain the hygienic condition of your area, because after intercourse, some foreign bodies may enter your vaginal part and it may cause infection. So obviously it is preferable to wash your vaginal area after sexual intercourse, so it will be better to prevent the infections. And last one is to especially keep clean and neat your intimate areas, so that if we are getting this healthy secretion also, it will not be converted to infection like leucorrhea or something discharges, and we will be healthy and fit. So this was about the topic of leucorrhea or vaginal secretion. If you have any doubts, you can comment in the comment section box. I'll go through. Thank you.